today we have a great duo on,
Yeah,
and
we got.
th- this is something. I mean, prevention as always, but an avenue we haven't checked into for. I don't think we've ever had something this topic on, but we have Andrea and Christina, two psychologists who specialize in eating disorders. So
That's pretty big.
yeah, and what's even wilder is eating disorders in adolescents.
Yep.
So I'm very curious to know, what is considered adolescent, and I'm gonna not not embarrassed to say I don't think I know all the different eating disorders. I know like the big two, but
Yeah.
I'm curious to know if there's more. I could be overlooking. Other parents could be overlooking.
Yeah. I feel like this is a big topic, but we don't often hear any kind of solution or resources for it. So
Right.
yeah.
Right. So hopefully they'll be able to shed some light, give us some information, and help us get this under wraps and get this information out there to the community.
Awesome. I can't wait.
All right. Without further ado, today joining us on Totally Preventable, we have Andrea Goldschmidt and Christina Tortolani, psychologists specializing in eating disorders. Thank you both for joining us. How are you doing today?
Great. Thank you for having us on Totally Preventable.
Oh, our pleasure. Our pleasure. Thank you. To get started as we normally do, won't you each tell us a little bit about yourself and how you got to where you are today?
I'm Andrea Goldschmidt. I'm a clinical psychologist and associate professor in the Department of Psychiatry at the University of Pittsburgh School of Medicine. I trained in eating disorders interventions and children and adolescents as a graduate student, and then continued to get specialized training in family-based treatment for restrictive eating disorders as a postdoctoral fellow and later faculty member. I've been at various institutions and now primarily identify as a researcher. I study mechanisms that drive binge eating in children, as well as how we can best implement evidence-based treatments for pediatric eating disorders in community settings to increase access.
Thanks, Andrea. And I'm Christina Tortolani, also a psychologist specializing in eating disorders. I also specialize in the treatment of trauma as well. I'm an associate professor at Rhode Island College in the mental health counseling program, as well as adjunct clinical faculty at Brown Medical School, where I enjoy training child psychiatry residents and fellows. I came about this work through, as Andrea said, through my education and my training. I hold it as a privilege to have a private practice where I see children, adolescents, and adults with eating disorders. I split my time between teaching how to become a therapist, also a passion of mine, as well as research and clinical work. And my research dovetails with Andrea's, exploring the dissemination of evidence-based treatments for pediatric eating disorders in novel populations and settings. I'm thrilled to be here.
Wow, with all that both of you do, I'm just happy you had some time to squeeze this in. That is remarkable work you're doing.
Well, thank you. We're also mamas, and that's important
too. Most important job, I understand.
Busiest job too.
This, of course, is a very important topic. I feel like with social media and everything these days that adolescents have an unhealthy expectation of what body image is. Do either of you have any goals for adolescents and eating disorders?
Well, first, I'd like to say that there are many misconceptions around eating disorders. So Andrea and I are both really excited to be here today to share our experiences with you on Totally Preventable. In terms of goals, I think first we'll start with a little bit of knowing the facts and dispelling the myths. And so eating disorders in children and adolescents are serious brain-based illnesses. They are medical and psychiatric in nature. So restrictive eating disorders lead to starvation, and starvation impacts one's body from head to toe, including hormones, GI tract, heart, brain functioning. In fact, the eating disorders are the most life-threatening of mental health diagnoses behind opioid use. It is a crisis, as you mentioned, and it needs to be treated as one. Given this, early intervention with a multidisciplinary team treating their individuals and families with evidence-based treatments is critical for best prognosis. And right now, our gold standard in treatment is called family-based therapy, or FBT. And so in terms of goals for our clients, really FBT empowers caregivers of individuals with eating disorders to take charge of their child's eating so they can gain weight and return to a normal growth trajectory. It also, one of the goals is empowering caregivers, meaning educating, equipping, and partnering with caregivers so parents can feel competent and confident to do the work of getting their kids back on their growth curve, which means brain recovery. So to do this, FBT is laser-like focused on behavior change and treating food as medicine until brain recovery can begin and then the adolescent can nourish themselves again.
Wow.
And I'll just add to that a primary driver of our research is making people in the community more aware that eating disorders are increasing in prevalence. They're often under-recognized and underdiagnosed, especially in youth that don't meet kind of the stereotypical backgrounds that are often associated with eating disorders, like in the lay media and the press and among community individuals. Which means that a lot of kids get left out of having the diagnosis and treatment is delayed, which can really enable the eating disorder to take a stronger hold on their brain and make recovery more difficult and challenging. So we hope that people listening today will really take away from this and understanding that eating disorders are prevalent in youth across the BMI spectrum, across the gender spectrum, across the racial and ethnic spectrum, and that early intervention is critical.
That actually leads me right into my next question, because I feel like you don't hear about as much in the media. You'll hear a little bit about what social media does, and then they'll fade away. You'll hear more about trends and things like that. Then all of a sudden a diet comes up. But you stating that, how common these eating disorders are amongst adolescents. What are some signs that parents should be aware of in order to identify these issues?
Yeah, so often parents and caregivers are the first people in an adolescent's life to recognize that there might be some concerns about eating going on. So, aside from what many of us think of as the most obvious sign, is a kid's weight. Most kids with eating disorders are actually not in an underweight category. So only about 2% of kids with eating disorders fall into the underweight category. The vast majority of adolescents and children with eating disorders are in a normal or even overweight range. So beyond looking for specific facets of weight that might indicate risk, we'd be looking rather at rapid and fluctuating changes in weight over time. So an adolescent has fallen off their growth curve, lost a significant amount of weight, or isn't gaining weight as they're supposed to stay on their prior growth trajectory. Oftentimes parents will notice changes in their child's eating behaviors as well. So things like cutting out entire food groups. What we will often hear in practice is that a child suddenly decided to become vegetarian or vegan, or decided to cut out sugar or flour, to eat healthier, but this can really reflect an underlying pathology as opposed to a desire to be healthier. Other things that parents might notice are food going missing, food wrappers in the child's bedroom. This can be indicative of overeating or binge eating, as well as increases in shape and weight concerns. So, a parent might notice that their child is becoming increasingly critical of their body or comparing their body to their peers in ways that they really haven't heard before. So we would just encourage parents to trust their gut. Parents know their kids best. And identify these concerns with the pediatrician or other trusted clinician to really get the help that's needed for what's going on with the child.
That's interesting. I've always thought that the weight was going to be the number one sign. So that's interesting. Can you tell us how eating disorders manifest differently between adults and children, and how that treatment would look differently?
While the majority of eating disorders develop in adolescence, no matter what the age, I often tell the people I work with that it's a perfect storm of variables that come together for an eating disorder to develop. And it can be sociocultural factors, genetic factors, temperament factors, life situations. And anorexia, most importantly, leads to starvation and malnourishment, which impacts one's ability to make rational, healthy decisions around eating, weight, shape, and its control. Anorexia is also egosyntonic. And so when you think about anxiety or depression, you think about egosyntonic. So many of us know people in our lives or ourselves who have struggled with anxiety and depression, and it doesn't feel good, right? And we are often motivated to seek treatment or to alleviate the symptoms. With anorexia, which is egosyntonic, we kind of flip that, and the eating disorder feels good. Often it's serving as a coping mechanism gone off the rails. And so adolescents and anyone with an eating disorder with anorexia may not feel, or likely will not feel, motivated to give it up. And so treatment often feels worse than having the illness itself. So when considering so that's kind of universal across, ages. When considering how eating disorders manifest differently in adolescence, I think we need to consider its impact on one's development. So adolescents are still growing, their brains are growing. There's a lot of physiological and psychological, development happening. It's a critical time. In fact, our brains are growing until age 26. So across the lifespan, treatment focuses on helping the person with an eating disorder nourish themselves, to gain weight and to decrease the symptoms of the eating disorder. Treatment for children and adolescents will likely involve the family and caregivers as supports in gaining weight. So providing meal support and meal supervision, while treatment for an adult may involve other family members or significant others to support treatment. For our adults, one of the treatment approaches that is most promising is cognitive behavioral therapy enhanced, which is also a behavioral treatment for eating disorders.
Now, I'm kind of going to feel a little embarrassed about this, but this is what this podcast is all about.
Amongst friends, Greg.
Yeah, thanks. Thank you. But anorexia, I know. Bulimia, I know. Are there other eating disorders that I'm not aware of?
Absolutely. Actually, binge eating disorder is the most common eating disorder amongst those that are identified in the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. So we all know about anorexia and bulimia nervosa because those are the disorders that are often featured in news articles. This celebrity has this disorder. They're sort of like the sexier eating disorders, if you will. But binge eating disorder is actually about twice as common as anorexia nervosa and bulimia nervosa. Most people with binge eating disorder do not know that they have an eating disorder. So binge eating disorder involves recurrent episodes of eating a large amount of food while feeling out of control, but it's not associated with purging behaviors that you would see in somebody with bulimia nervosa. And because of that, it's often associated with a higher BMI. And so people will often come in wanting help with managing their weight, not knowing that they actually have an eating disorder. So those are three of the main eating disorder diagnoses. There's also avoidant restrictive food intake disorder, which looks pretty similar to anorexia nervosa in terms of there being significant restriction of food intake and avoidance of foods, but without the shape and weight concern. So ARFID, as it's called, is often driven by texture issues, fear of vomiting, other concerns besides wanting to be at a lower weight or wanting to change your body size or appearance. And then, of course, there are multiple iterations of these disorders that present in sort of sub-threshold forms where a person might not meet the criteria for a full diagnosis, but has maybe some lower frequency symptoms, or the disorder has just started and they haven't yet met full criteria. One of the things that we also know about teens particularly is there's also often a lot of fluctuation between the disorders. So an adolescent who currently meets criteria for bulimia nervosa could lose 10 pounds and then meet criteria for anorexia nervosa. We know that they haven't changed disorders over time, just that the diagnoses shift in response to different behaviors. So there really is a lot of overlap in the behaviors associated across these disorders and a lot of movement between categories over the course of development.
Wow. Now, when you say textures, I think it was ARFID.
Mm-hmm.
I often think about, sensitivity and textures, especially with adolescents with autism and
Yep.
on the spectrum. Is that something that is commonly found?
Yeah, so this is really a new area of study. ARFID just made it into the DSM recently, and research has sort of exploded since then, but there's still a lot that we don't know about the diagnosis, but there does seem to be an overlap with autism spectrum disorders, which can drive some of those sensory textural concerns that you're describing.
Thank you.
So are there programs that parents can be part of to help their children with any kind of eating disorder they may have?
Family-based treatment, which Chris described earlier, is really an intervention that's centrally focused on the caregivers. So the family will meet with their therapist once or twice a week, but is really responsible for delivering the intervention to their child in the home throughout the remaining hours of the week when they're not in therapy. So the therapist role is really to coach the parents and caregivers to help the adolescent make healthy choices to get back on track with their eating and weight. FBT is an intervention that is growing in availability, but is not widely accessible to many families. So right now we're aware of research going on that's testing digital interventions where parents can engage in FBT from across the country. FBT can be delivered in telehealth format too. And Chris and I are currently leading a study called Project Home, which has 2 sites in Rhode Island where we are training community mental health providers to deliver FBT in a home-based level of care. So in this intervention, the therapists are actually traveling to families' homes in the community and delivering the intervention in their home and other community settings like doctors' offices. They can go to schools with the kids, and really helping to foster sort of a wraparound care to implement FBT across multiple levels. So there are many ways for parents to get involved in their adolescents treatment. CBT, which Chris also mentioned earlier in the program, often involves having parents join in for sessions as collateral informants and supporters. And they can be doing things like helping their teen self-monitor or do exposures throughout the week to help them really kind of increase the number of settings and opportunities to modify their dysfunctional thoughts and beliefs around their eating, weight, and their bodies.
Now, you're mentioning some great ways that parents can play a supportive role in their child's recovery. Does the stigma ever come into play for a parent during this process? And is there something to help parents in supporting with that?
Gosh, I'm so glad that you're bringing that up. working with many parents over the years and families who are on this journey of recovery with their children, they often come into my office and they feel blindsided by the onset of the illness, feeling like they don't recognize their child anymore, as the eating disorder has somewhat hijacked their child. They may feel like they're waging war against something and they're exhausted. They may also experience guilt and blame for, why is this happening? What did I do to contribute to this? And as a parent myself, I can understand kind of these questions. As we know, eating disorders are misunderstood by the lay public. And so often eating disorders are treated silently or secretly, or, there's a lot of shame around having a child with an eating disorder. And one of, the places where I've met with parents and been able to really explore this is in multifamily parent groups. Where parents can come together, they can hear one another's lived experiences in treating their children. They can feel support and empathy and validation and strength around knowing that, one of the things FPT, really believes is that no one is to blame for an eating disorder, including parents, and really absolving parents of this blame helps us be more effective in doing the hard work of helping our children recover. So I think that having spaces where parents can help parents go through this process is really important. Some of these places include the FEAST website, which stands for Families Empowering and Supporting the Treatment of Eating Disorders. They have an amazing program called the First 30 Days, where parents for free can sign up for this service. And it's that each family who signs up for the service will get one email every day for 30 days. That takes about 30 minutes to review. And it's built for parents by parents. And they have, it's a wealth of resources, including, blogs and videos and, virtual spaces where parents can get support. So I think that's one great one. There's also the Full Bloom podcast, which is really excellent. There's Eva Musby, who is a parent of someone who's recovered from an eating disorder. She has a book as well as many videos that help provide parents the tools. And also more importantly, I would say, is the community.
And I heard you say it wasn't the parents' fault, but are there ways that parents can promote better self-image or things that they can do along the child's life to help prevent any eating disorders?
Yeah. Well, I think many people struggle with their bodies, body image, struggle with food and dieting. And we are living in a culture where there are a lot of toxic messages about that, and many different platforms through which people, can learn about this. And I think that's kind of really dangerous. So I think, how can parents help? I think parents can help monitor social media and what our kids are learning and absorbing around, most things, especially, body image. I think parents, we want to be role models to our children in terms of what our values are, right? And how we feel about our own selves. And so I think modeling a healthy relationship with food, how we speak about our bodies, instead of saying, ugh, I'm so fat, really exploring that and understanding what am I really feeling here? And what messages am I sending to my children right now? We know no one's perfect, right? And I think it's also about honesty and understanding that or acknowledging that it's like swimming upstream, to be brave and to talk about, issues related to food and weight and body, and to lean into that and have these conversations with our kids.
I am 100% guilty of the, oh, I'm so fat. Daddy's got to lose some weight. I say that probably once a week, but do I do anything about it? No, but I do say that. And now you've got me thinking about I should start doing something rather than just talking about it. What educational initiatives are you aware of that are geared towards raising awareness, if any, raising awareness about eating disorders in schools and communities?
Yeah, so that's a great question. I think an area where there needs to be more research because healthcare providers, from your pediatrician that you've had since your child was a baby, to the school nurse and teachers and gym coaches, can be really important sources of information in identifying when there's a concern of an eating disorder going on. So the Body Project is one intervention that's being widely disseminated across schools. It started out as a project that was targeting college students, but has now been adapted down to the high school level as well, and is being implemented at sites across the country, really focusing on reducing eating disorder risk factors, the primary ones being really high shape and weight concerns that would drive eating disorder symptoms. And the Body Project is a pretty brief 4-session intervention typically, which focuses on creating kind of dissonance between your attitudes towards your body and your behaviors. So having participants do things like writing a letter to the culture about why the thin ideal is not realistic, can create a sense of like wanting your attitudes to match up with your behaviors. And the idea is if you engage in behaviors that are antithetical to your beliefs, that eventually your beliefs will change. And so this is one area of work that's currently ongoing in research and in community settings. We would also encourage schools to reach out to local eating disorder experts to come and speak to parents and educators about ways that they could become more aware. We know that right now, especially in sort of the post-COVID environment, mental health concerns are on everybody's radar. We're all aware that teens today struggle with anxiety, depression, and other mental health concerns at much higher rates than maybe we were aware of before. And I would just encourage families and educators to put eating disorders on the list because we know that COVID has really impacted both the prevalence and severity of eating disorders in teens. And so people that are on the front lines, families, teachers, sports coaches, primary care physicians, these are all the people that can really make a difference in getting a kid identified early so that they have the best chances of recovering long-term.
Do you have any success stories or testimonials that you could share?
Gosh, there, are so many and Andrea, I'm sure you could just call to mind, all of the children and adolescents and families who have climbed the mountain of recovery and reached the top and really been able to, see life through a different lens once you, let go of the eating disorder. I feel really lucky that I've seen so many patients recover no matter what their age. I think recovery is about mind-body connection. It's about a personal journey of self-discovery. I think it's, often the eating disorders kind of keeps horse blinders on our patients, and it keeps them really, focused on the eating disorder itself. And so when our clients are able to let go of the eating disorder, suddenly their perspective and perception of the world and of themselves and others can be broadened and opened up to really a world of discovery. And it's really a privilege to witness this process.
I have to say my favorite success stories are always the adolescents who will talk to me at the end of therapy. Most frequently when kids come in for treatment, they don't want to be there. They're angry. They glare at me or don't say a word. And occasionally we'll get a team that, throughout the course of treatment, will kind of open up little by little. And then at the end, kind of recognize that although I hated you at the beginning and I was so mad at my parents for making me come, I'm so glad that they stuck with me because I feel like a different person. Once the eating disorder is off their back, they can really experience life and normal adolescent development like every teen is supposed to.
Now, that brings me to a question. Is eating disorder a teen issue, or can it be younger?
So we're seeing eating disorders in children as young as 5, 6, 7. It's the most frequent age of onset is during the transition from childhood to adolescence, and often a spike when kids go off to college around like the emerging adult years as well. But we are seeing these disorders presenting in very young children. So they're definitely not just disorders of adolescence, though they often start in adolescence. We keep saying early intervention and prevention as soon as possible for the best chances of recovery. And a subset of individuals will go on to continue having these disorders as adults or go on to have sort of a fluctuating course where maybe there's periods of recovery interspersed with periods of relapse. The important thing to remember, though, is people can recover at any age. There is no age limit on recovery. And it is always the right time to seek out recovery. Whatever your age, whatever your history of treatment, whatever your prior successes were, it is worth it.
That is a great message to end it on. That is great for community or for school administration or for parents who or maybe even an adolescent looking to start their journey or looking to start to get some questions and answers about eating disorders. How can they become more engaged? How can they be involved with your programs?
I'm going to share some links with you after. We have lots of materials to share with families that are interested in becoming involved in any of our research projects, as well as links to local treatment centers. Chris and I are very involved in the Rhode Island eating disorders community. And now that I've transitioned to Pittsburgh over the last few years, becoming more connected in the Pittsburgh community as well. But there are more treatment resources than ever. And like I said at the beginning, we're seeing a big increase in telehealth availability. So families can find accessible ways to get treatment for their children. And if there's interest in getting involved in research as well, there are a lot of programs going on around the country, and we're happy to share some resources with you all.
That is great. So we'll attach that in the description on that upcoming podcast.
Awesome. It was great to meet both of you.
You too.
I feel like I learned a lot too. I feel like I've been using some wrong language and had some more incorrect assumptions, I think. So this has been very helpful.
This was
Thank
so
you so
fun.
much for having us.
It's our pleasure. Thank you so much. We'll be
It was
reaching out
really
again.
nice talking to both of you. Yes. So I will share, I'll share our website, which has information about all of our studies. And then I'll also, if it's okay, send a flyer for our home-based project for parents that want to get into treatment.
That is awesome. Thank you.
We appreciate it.
Thank you so much. This was
Our
so
pleasure.
Yeah.
Nice to meet you both.
Have a
Take
great
care.
holiday.
You as well.